Hi, my name is Maria Mancini, and I will be a senior at Lake Catholic High School. I am part of the Medical Laboratory Internship at the Cleveland Clinic. My presentation today is Surgical Pathology Capacity Analysis. Surgical pathology plays a vital role in patient care by aiding in the diagnosis of tissue samples removed from surgery. Each tissue sample is categorized into a certain anatomic specialty in our laboratory. In the lab at each bench, they are specialized in processing a few of these anatomic categories. For time efficiency, it's beneficial to analyze the time per specimen in each category and place them so that they're distributed equally among the lab benches in time. This way, each PA has an equal amount of work distributed amongst them. These times can also be used to calculate lab capacity and determine the ability to take on outside volume from additional areas in the Cleveland area. Capacity analysis can help in making purchase decisions and in scheduling employees. This study was conducted to discover the most effective placement for tissue types among the surgical pathology benches. And they also determine the ability to take on additional volume in outside samples and sale agreements. This can bring in additional revenue for our laboratory. The benches are divided as follows. Our C1 bench has gastrointestinal tissue, soft tissue, hepatobiliary, and dermatological tissue. Our C2 bench has genitourinary, orthopedic, lymphoma, and pulmonary tissue. Our C3 bench has breast, gynecological, ear, nose, and throat tissue. The study was conducted by each sample received in the lab being sent to a specific bench based on an anatomic category. The time used to process each sample was then recorded. Multiple pathologist assistants, also called PAs, and residents were timed and averaged to ensure accuracy. Volume reports were then run for each sample type and to determine each number of type of tissue received per week. Total work time for each bench was calculated using sample times and number of samples. To calculate bench capacity, total work time was divided by available time to determine the percent workload using this formula. Here on this graph, we see the distribution per week by specimen. Each category is listed on the right, and they are divided with the most being ear, nose, and throat. On this graph, we see work hours per week divided by each specimen type, the highest being gastrointestinal and ear, nose, and throat. And on this graph, we see our divisions by lab bench in our percent bench capacity. We can see that our C1 bench has the highest load and our C2 bench has the lowest, but they are all pretty equally distributed. In conclusion, our laboratory benches in surgical pathology are approaching capacity, but there's still much room for growth. More work may be taken from outside samples and sale agreements, which will bring in more revenue for our laboratory and be more efficient for each PA. Our C1 bench has the highest workload, therefore some specimens may be moved to other benches for more efficient arrangement. More time for record processing times to record record processing times would allow for more accurate averages and more overall precise capacity analysis. More outside specimens may be taken to expand laboratory output. Due to accessioning processes, volume analysis was restricted in some tissue types, therefore some times were estimated. More accurate data may be needed to ensure precise calculations. Thank you to Brad Skilton, Mindy Krall, Aaron Gomez, our Surgical Pathology Department, and the Office of Civic Education Initiatives. Thank you.